Hello, everyone. It's Thursday, July the 1st. I've got 18 additional deaths that I've got to read through. Some of these are just getting into our system, and they're older ones, that don't reflect really how we've done in the last couple of days. We've really just lost a total of, I think, 5 folks of the 18 are just in the last couple of days. But in being respectful to everyone, we want to read every one. Some of these are just now getting into our system that go back to April and May, but this is just part of it, and how sometimes they flow into the system in a slower manner. We're working on a new system that, to be perfectly honest, Bill Crouch can probably tell you better about, but it probably is still going to take another 6 months to have that online to where it's just flawless going forward in the future. But today, like I said, we have 18 additional folks. 5 of them are in really the last few days. But the 2,880th death in West Virginia is a 79-year-old female from Gilmer County. The 2,881st death is an 88-year-old female from Wayne County. The 2,882nd death is a 76-year-old male from Berkeley County. The 2,883rd death is an 84-year-old female from Jefferson County. The 2,884th death is a 90-year-old female from Wayne County. The 2,885th death is an 81-year-old female from Mineral County. The 2,886th death is a 79-year-old male from Wetzel County. The 2,887th death is a 65-year-old female from Braxton County. The 2,888th death is a 54-year-old male from Fayette County. The 2,889th death is a 94-year-old female from Marshall County. The 2,890th death is a 76-year-old female from Mercer County. The 2,891st death is an 83-year-old male from Kanawha County. 11 of the 12 deaths that we reported right there are the result of DHHR's data, reconciliation with the official death certificates. And they continue to work this, and they continue to do great work with all that and everything. But until we get that new system in place and everything, we're going to have to continue to deal with this and everything. But we're going to bring it to you as we get it, that's for sure. As of Thursday, July the 1st, again, we had those 5 deaths that I've referred to, but we have a 52-year-old female, our 2,892nd death, a 52-year-old female from Kanawha County. The 2,893rd death, a 40-year-old male from Mercer County. Daggone. I'm sorry, let me go back. The 2,893rd death is a 48-year-old female from Mercer County. The 2,894th death is a 94-year-old female from Mercer County. The 2,895th death is a 76-year-old female from Mercer County. The 2,896th death is an 89-year-old female from Taylor County. And the 2,897th death in West Virginia is a beautiful, beautiful lady, a 104-year-old female from Mercer County. 2,897 folks in West Virginia have perished with this dreaded killer. Absolutely, you got to continue to help me. You got to continue to help me get people vaccinated. We're down to 56 new positive cases in West Virginia, since day before yesterday, or since yesterday. Our daily positivity rate is at 1.53. Our cumulative percentage is now at 5.01. It would be really great news if we can break under 5%, and we're on our way to do that. Our active cases are down to 1,334. We're still right at 160,000 people that have recovered from this dreaded disease. 76 people are hospitalized and 19 people in the ICU units. And now again, we have no red counties, no orange counties, no gold counties, and one yellow county in Wyoming. We're really close to getting this whole state in the green. You know, from the standpoint of reminders, if you're 65 and above and you get any symptom at all, please go get tested. Please go get tested. The antibodies can save your life. Well, as we said over and over, all those 12 and older are eligible for your vaccine shot. You've got to get your second shot. If you've only gotten one shot of Pfizer and Moderna, please get your second shot. It'll absolutely ensure you from getting this dreaded killer on almost 100%. You've got to get your second shot. From the standpoint of the Delta variant that we're all concerned about and is really beginning to in its infancy to move in West Virginia, these vaccines are extremely effective, you know, against that variant. You know, again, I ask our older people to help us from the standpoint of the parents and the grandparents to get the folks that are 12 to 35 years of age vaccinated. Now, let me just tell you this. I just got through doing a news special on ABC News. You know, one of the things that was brought up is you know, as we go forward, West Virginia, like a bunch of other states, still continues to struggle with getting more and more of our young people vaccinated. Now, and so that's why I ask you over and over and over. But here's the facts. Here's the facts that you should remember and remember always. West Virginia, the state with the most chronic illnesses, and a state that's the third oldest in the entire nation. You don't have anything to be ashamed of. You don't have anything to back up from anybody on. Just think about it. First in the nation to get our nursing homes vaccinated. First in the nation, absolutely, to stop the nursing home visitation. First in the nation on the vaccine rollout and how we got people vaccinated. Think about this. Now, these numbers are real. We have 87% of our folks that are 65 and older vaccinated in West Virginia. We have nearly 78% of our folks that are 50 and older vaccinated in West Virginia. Our death rate compared to our neighboring states is only a fraction of our neighboring states. You don't have anything in the world to back up to anybody on. West Virginia not being protected by that ocean and being the third oldest and absolutely having chronic illnesses like crazy. We could have been a disaster, and we've been a shining star. You don't have anything to back up to anybody on, and not only on top of all that, you have the economic engine of our state running absolutely phenomenal. I'm going to report to you right now numbers that just came to me from our revenue folks. Now just think about this. In the state of West Virginia, in the year that we just ended on June the 30th, yesterday, we came in at $458.1 million. $458.1 million above budget. Absolutely a surplus that is unprecedented. Twice I've called the legislature back in to spend those dollars on things that can help West Virginians. We did one move of $150 million on all of our roads to fix the slides and the ditches and the pavements and the potholes and the guardrails in all 55 counties. We absolutely are on top of that in every way. In the next move, we sent up $250 million that we could spend throughout West Virginia on all kinds of different projects and everything that'll just help West Virginians. The legislature stepped up in a great way. All of the things that we asked for, the legislature came through on except a very, very, very small amount, which was almost insignificant. When it really boils right down to it, I think it was about $3.5 million of the total $400 million that we sent up there. So really and truly, I salute the legislature and I thank them in every way. I thank President Blair, I thank Speaker Hanshaw, I thank all those that stepped up on both sides of the aisle to do the right thing for West Virginians. In addition to all that, we put $50 million in the rainy day fund to cap the rainy day fund off at over $1 billion. We're in great shape in West Virginia. We absolutely have handled this pandemic, and you have done wonderful, West Virginia. You have nothing to back up to anybody on. You just think. We absolutely identified that this terrible killer was going to attack our elderly people. 87% of our people that are 65 and older are vaccinated. 87% of them are safe. Of the people that are 50 and older, 78% of them are safe. We've rolled out and we've shocked the whole world. The third oldest state, the most chronically ill state, with no protection around it. You have absolutely shocked the world. And now, just think about it. You have got economic numbers that are off the chart good in every way. I want to just read to you just a couple more things. We had an income tax reserve fund. And last year, absolutely to ensure that we got our income tax refund checks out and got them out fast and got them out timely and everything, we basically, through that year, drained that income tax reserve fund down to zero. Through the pandemic, we had to. But what we've done now is we've done just this. We have absolutely asked the legislature to step up on $400 million. They did so. And those dollars will be flowing through projects to help our roads, to help all kinds of different projects all across this state. And absolutely in that now, we have, in addition to that, we have been able to put $45 million more back into the income tax reserve fund to ensure getting those refund checks out and getting them out on time. From the standpoint of our consumer sales tax, think about these numbers. We came in at 9.1% above budget in June, and we came in for the year in consumer sales tax in West Virginia at 10.9% above last year. From the standpoint of corporate net tax, now think about this one. If that one didn't blow you away on consumer sales tax, think about this one. We more than doubled in the year that just closed. In the year of June that just closed yesterday, we more than doubled the amount of corporate net tax brought into West Virginia than we did the previous year. The previous year we brought in $152 million. This year we brought in $320 million in corporate net tax. From the standpoint of personal income tax, we're up. We're up this year compared to last, 15.7%. And the last thing, and I'm so proud of this, this is off the chart with me. I am absolutely so proud of this, it's unbelievable. From the standpoint of our natural resources, coal, oil, gas, from the standpoint of severance, we have had a major recovery in the last half of the year. Now, I don't mean the last half of the year that's coming up, I mean the last half of the year that we've just gone through from January to June. Now, you just think about it. Just think about this. Last January, we were 50% down on severance tax. 50% down last January when we were halfway through the year. Now remember, our year starts on July 1st, and it goes till June 30th. We just closed out our year yesterday and everything. But last January, halfway through the year, we were 50% down on severance. We ended the year up. We ended the year up with a 2.7% gain over the prior year. Absolutely, our severance tax dollars coming in the last half of the year have had a major recovery. And that's great stuff for all of our coal miners and gas workers. oil workers, lots and lots and lots of folks all across our counties and everything else. But the last thing I'd say, but the fact that our state is diversified today in many different areas, from medicine to high tech to tourism to all the different things that are happening all across our state. Severance tax being up is another goodie, that's for sure, but it is not the only goodie. In fact, it's a long ways from it. In fact, I don't know exactly what the numbers would be today, but over the last couple of years, we've been able to report the percentage of our dollars in total revenue coming from severance tax are probably the lowest that they've been in decades. And so if they're the lowest that they've been in decades and West Virginia's doing so good, well, why is that? We're diversified. We're absolutely doing things in a lot of different areas. And when it gets like that, it can't be any better. So I congratulate everybody across this great state that have stepped up in lots of different ways. I thank our broadcasters, and I thank everybody that stepped up trying to help get more and more and more folks vaccinated. And I absolutely thank everybody from our revenue department and everybody in my office and all across this land that have done unbelievable work. There's a lot of heroes out there, a lot of first responders and a lot of people in the healthcare community and everything that stepped up. Lots and lots and lots of folks. You've done really good, West Virginia. I am really proud of you. Now, I've got to talk a little bit about Baby Dog. Yesterday, we had a great day. We want to try to create as much excitement as we possibly can. Baby Dog sure did this. I mean, she's a heck of a lot more popular than I'll ever be, but that's great with me. Everybody loves her. And, and you can say what you want. It's a pretty dadgum good marketing tool because you got this little dog that everybody, when they look at her, they smile. And everybody that, that she sees, she loves with all of her. And that's really great stuff. We started the day out yesterday at, right out in really northern Greenbrier County. And there's a lady that won. We gave away 2 trucks and $1 million yesterday, and a lot of other stuff that was done online. But we went and gave away, the trucks and $1 million. It was an exciting day, and we surprised some people, that's for sure. And but right there, you'll see all 3 of the winners. And Tracy Brunel, and I may pronounce that wrong, and if I do, please forgive me, Tracy, but what a wonderful, really sweet, great lady, from Frankfort, West Virginia. That there she is right there with her mom. And then Sierra Jacobs from Parkersburg, a lady that's doing phenomenal work, looking after and protecting our folks in West Virginia. And when she walked out, she had no clue what it was either and everything. And when she walked out and everything, she thought she was coming to be able to get to see Baby Dog. She said, "Oh, there's Baby Dog," and everything. She had no idea. When she realized she had won the truck, she just went crazy and everything, and it was really good. She said her husband was hoping that he'd win the truck and everything, but she won it, and she was pretty daggum proud and everything. And then we ended up the day in Morgantown, an absolutely beautiful lady, Sharon Turner, and Sharon has been a lifelong resident of Morgantown, and absolutely lots of people stepped up. State police said, what an incredible lady she's been. She's been a trooper beyond belief, and she went completely crazy. We were able to give that award to her. She brought her daughter, her granddaughter, and her daughter's boyfriend all came with her. They had no idea and everything. They thought really it was Sharon's birthday yesterday, and they thought they were coming to do something about her birthday party, and what a birthday gift and everything. So Sharon, we congratulate you, Sierra, and Tracy, and all those winners. And right now we've got a special lady that's on with us, and she's from Painesville in McDowell County, and I think she goes to Riverview High School, and she's just graduated from Riverview. She was the captain of the girls basketball team there. I'm anxious to ask her if we played them. I don't really know if we played them when she was there or not, but she is one of our scholarship winners, and that scholarship will include room and board, tuition, books. It'll include every single thing to any of our four-year institutions across our state, and I couldn't be more proud of her. And I could also not be more proud of Brendan Lee. Brendan is from Falling Waters in Berkeley County, and he also won one of our scholarships and everything as well. So if we can have her come on right now. If Jenna, I think Jenna's on with us. Hey Jenna, how you doing?
Hi, I'm good.
Well, Jenna, we're proud of you, girl. Did we play you guys? Did Greenbrier East ever play y'all?
I think my freshman year.
Okay, well, you were probably great then too. So anyway, I just want to congratulate you and hope this was a great day. I know from the standpoint of winning like this, it's got to be good stuff.
Thank y'all so much. I really do appreciate all of this.
Well, thank you for getting vaccinated. That was really good and everything. And you just helped me to get everybody down there vaccinated, okay?
Okay.
All right, now I'm going to hold you to that and everything. But anyway, and I'm going to keep up with you. You just keep doing good stuff, okay?
Okay, thank you.
No, proud of you, girl. Now hold on here. Well, I got to show you this. No, go back to her a second. All right, look here. This is your backpack you're getting, and it's got "Do It for Baby Dog" on the backpack that we want, and you're getting this right here too. And this is, your certificate from the state of West Virginia. It says, "State of West Virginia, do it for baby dog, save a life, change your life. Greetings, be it known that Jenna Atwell from Painesville, West Virginia, is hereby awarded this full 4-year scholarship to be used at any public institution in the great state of West Virginia." It's got baby dog's footprint right there and my signature right there. Jenna, way to go. Really proud of you, girl. You'll be getting all this, okay? All right, thanks again. Okay, if I could just tell you real quick too, we'll continue these drawings for, I think, is it 4 or 5 more weeks? 5 more weeks. And if you haven't gotten your vaccination, you're crazy. I mean, that's all there is to it. I mean, come on. I mean, for crying out loud, all you got to do is get one shot, get your vaccination, and then register. There's 322,000 West Virginians that were registered. You've got a great chance of winning all kinds of stuff here. Get yourself a vaccine and then get registered. Your odds are better than ever. You've just got to get yourself vaccinated and get registered, and especially all you young people, come on. We've done a great job with our 65 and older, and we want to continue to get more of them vaccinated. Young people can encourage them. Our 50 and olders, we've done a great job there. We want more of them. But absolutely, if you're 65 and older or 50 and older, encourage the young people. Encourage the young people to go on and get vaccinated. It will stop this disease. But absolutely, we need you. We need you to encourage over and over and over those people. And then lo and behold, good things happen. I mean, look, a beautiful young lady in her 20s and everything just won one of the trucks. Absolutely. Jenna and these people are winning scholarships. Brendan and Jenna, are winning scholarships and everything. Get vaccinated. You're in a lottery whether you like it or not. I mean, when it really boils right down to it, you're either in the lottery for goodness, all the goodness that can happen, all these prizes. You're in the lottery of protection because you got vaccinated. You're in the lottery that absolutely will shut down this Delta virus, or variant rather, and absolutely it will stop it from getting you, or you're in a lottery that's a race to see who's going to die first. That's it. You're either one or the other. The wheel is turning every day. The virus is still with us. The variants are still with us. You're either in the lottery of goodness and protection and prizes, or you're in the lottery of death. And is your number going to be called? Are you going to lay there suffering? Are you going to gasp for your last breath? Are you going to do that? Or are you going to be in the lottery of goodness? It's just one of the two. So nevertheless, we'll continue to try with all in us to get more and more folks vaccinated. Every day, every single day, we get a few more. And that's the only thing I know we can do, is just keep trying. Like I said before, we're now at 63.9%. We're at 64% for all practical purposes of all those 12 and older. Come on, we just keep crawling toward that 65. And when we get to the 65, we want to go even higher. Come on. Don't miss all the prizes. Don't miss Baby Dog coming and seeing you. Don't miss all the goodness that you are doing to protect all those around you and yourself. If your churches, if your manufacturers, if your businesses, just call us. We'll come and we'll vaccinate all those folks that you have. From the standpoint of the vaccine info line, it's all up there. All the testing is still free. Get tested and everything. If you have any symptoms whatsoever or anxiety or whatever it may be, I always want to thank Fruth, and I want to thank Walgreens for all the great stuff that they did. We have really only one new outbreak in our long-term care facilities. We have 4 outbreaks we're still cleaning up there. We have 0 outbreaks in our churches. It's unbelievable. We have 1 inmate in the state of West Virginia that has this dreaded disease. Like I said before, if you just step back and think in West Virginia, first in the nation on nursing home visitation, first in the nation getting our nursing homes vaccinated, first in the nation on the rollout of the vaccine. Absolutely, today we got 87% of the 65 and older vaccinated, 78% of the 50 and older vaccinated. Absolutely, we only have 1 inmate in the whole state that has COVID. 1 inmate. We have 0 church outbreaks today and 1 new outbreak in our long-term care facilities. We're going to take a back seat. Not on my watch. No way. We're not taking a back seat to anybody. Absolutely, this state with no ocean to protect it, old, chronic illnesses, and we've led the way over and over and over and over. And not only that, we've done it economically too. So West Virginia, you've got to be really proud. From a weather update, we've got some bad weather and everything that's been out there. We've had some heavy rains and we've had some flooding and everything. Ohio County, Marshall, Brooke, Hampshire, Kanawha, and Morgan counties, and we want to be on the watch and everything, especially this time of year. We get big thunderstorms, we get big rains and everything. Our mountains are our mountains, and we're going to have to deal with it and everything. And we've got emergency management people that are out there working all the time, and we want to continue with them to run to the fire, and that's what we'll do. But just be on guard about that. You've got to always be on guard in West Virginia. And the 4th of July is Sunday. Kathy and I wish everybody in this great nation, and especially in our great state, a happy Independence Day, and encourage people to spend some time over the weekend with your loved ones and everything. And remember just all those that fought and still continue to fight in our armed services and everything. All those we lost, and all those that give us the 4th of July. That give us our freedoms. I've said it and said it and said it and said it. You owe everything, and so do I. Every single thing that we have in this great country, we owe to our military and all the greatness that they have delivered and all the sacrifice that they've been through and all their families. So think about them. Think about them over the 4th of July. It's supposed to be pretty weather. get out, go to our parks and everything. We've made incredible upgrades to our parks. Enjoy almost heaven and absolutely be proud. Be proud of what you've done, West Virginia. Keep doing it. Just keep doing it. We're just going to keep rubbing it in their face. All those states and all those folks that looked at West Virginia as a state that was poor or backward or whatever it may be, rub it in their face. Rub it in their face. Absolutely. You've done great. Way to go.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. And following up with what the governor has already talked about, I wanted to address the Delta variant, which is the variant of COVID-19 that has come to the rest of the world from India. And as most people will remember, we have had the most problems and the most virus in West Virginia as being typed and identified to be the United Kingdom variant. And that variant is more infectious than the initial COVID virus that we saw. And if you remember, the original COVID virus, one person infected would infect about 2.3 to 2.7 new people. The United Kingdom variant, which is the most common variant in the state, has a reproductive value of about 4 to 5, meaning one person infected will infect about 4 to 5 new people. The Delta variant, which is the variant that was started in India, has a reproductive score of 5 to 8, meaning one person infected will infect 5 to 8 new people. So this is a different virus. It's much more transmissible, much more infectious, and it seems to infect almost always people that are not vaccinated or people that are partially vaccinated. When we look at the impact of the vaccines, we know that people that have received their full vaccination of Pfizer or Moderna and are 2 weeks after that last immunization are protected at about 88 to 92% from becoming infected and protected over 96% from getting really sick, being hospitalized, or dying. And in fact, if you look across the country now, all of our deaths are seen in basically all in people that are not vaccinated. Now, one thing that's important to note from the Delta variant, because it's so much more infectious, is that one dose of the vaccine is not nearly as effective as 2 doses. So we really encourage any West Virginian who's had 1 dose of the Pfizer or Moderna vaccine to go ahead and get that second dose on the appropriate schedule, 21 days after the first dose for Pfizer, 28 days after the first dose for Moderna. It's also important to recognize that the Johnson & Johnson vaccine is being evaluated right now for its benefits, its impact in protecting people who may be exposed to the Delta variant. And we know from work in England that the AstraZeneca vaccine, which is very similar to the Johnson & Johnson vaccine, is about 92% effective in keeping people from getting severe illness or hospitalization or death. And we're currently assessing whether the Johnson & Johnson vaccine works as well, or perhaps whether people who've had a Johnson & Johnson shot may eventually need to get a second shot. And that's being assessed right now by the Centers for Disease Control and the Food and Drug Administration. It's also really important to note that even though hospitalizations are down, as the governor said, that today in the United States, about 1/3 of the hospitalizations are occurring in people under 30 years old, oftentimes in people not vaccinated, but even in children. And we know now that the lower limit of vaccine eligibility is 12 years old, but even in children younger who have chronic health conditions, who have asthma, who are overweight, who may have pre-existing congenital heart disease or something else, then they are at higher risk to getting very ill from the COVID virus, particularly the Delta variant. And last, so therefore, children the Food and Drug Administration and CDC is looking to see what are going to be the criteria to try to reduce the age of eligibility so that more children can get vaccinated. But also in this meantime, particularly as the Delta variant starts to grow, then we have to be cognizant, and we want to protect our unvaccinated children. And that's particularly important if they're surrounded by adults or family members who are not vaccinated as well. On June 5th, the Delta variant accounted for 10% of the cases of COVID virus in the US. By June 20th, the Delta variant now accounts for 26% of the cases of COVID-19 in the US, and a genetic company that follows the sequencing says that about 40% of the viruses they're finding in the US are from the Delta variant. So the Delta variant is growing. In West Virginia, we now have 12 cases of the Delta variant, and Dr. Amjad will go over some of that. But it's really important to us. We have a window, we have a time that we can really start to continue to accelerate the number of people being vaccinated. And with the Delta variant coming to West Virginia, and with all the characteristics of our state, the third oldest state, the state with many people with pre-existing health conditions, the state that the Kaiser Family Foundation rated as the most vulnerable going into this pandemic, it is so important that people choose vaccination and really get completely vaccinated. One vaccine is better than no vaccines, but certainly not completely protective against the Delta variant. We really want people to get both vaccines and to have that 2-week window afterwards. So thank you very much.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. I'd just like to highlight a couple of points that the governor made. We are just keeping at it with the vaccination process. We continue to look for different ways to get more people vaccinated. As the governor pointed out, 50 and above, and particularly 65 and above, West Virginians are doing exceptionally well, but we will continue to go get more 50 and over vaccinated. We also will continue to work hard to make sure, as Clay points out, the second dose is important, particularly with these variants. We will continue to work on those. You will notice today potentially no changes in the data. There was a problem in the CDC data system today, so we will probably not see an update until tomorrow morning on that. Also, I didn't have the opportunity on Tuesday, but I would like to, on behalf of myself, the members of the Guard, and the Interagency Task Force, thank Dr. Sherry Young. Wish her well in her new position, but thank her for the professionalism and partnership that she displayed with us. We did a lot of good things together. It saved a lot of West Virginians, particularly in Kanawha County. And last thing I'd leave you with, the governor talks a lot about, is we need to tout how well we're doing and what great things we do as West Virginians. And coming into the 4th of July, I'd just like to remind all West Virginians that we've been defending this nation since the inception of the nation. One of the original militia companies that helped form the Continental Army, its lineage lives on today as part of the 201st Field Artillery West Virginia National Guard, making it the oldest continuous serving unit in the United States Army. So thank all of those men and women from the United States military, and particularly our National Guardsmen here in West Virginia, for their service. Thank you.
Thank you, sir. Next to Secretary Bill Crouch with the DHHR.
Hello, everyone. I would also like to thank Sherry Young for her service, her public service during this pandemic. She worked tirelessly for Kanawha County and other counties around her, and I wish we had more Sherry Youngs in public health, not fewer. So thank you, Sherry. Also want to mention that DHHR's Bureau for Children and Families will begin accepting school clothing allowance applications beginning today through July 31st. These are for eligible children enrolled in West Virginia schools. Each eligible child will receive a $200 benefit that may be used towards the purchase of appropriate school clothing or piece goods if the families sew clothing items themselves. Families may apply online at wvpath, That's wvpath.org, or request a paper application from your regional DHHR office. If you need assistance with this benefit, please contact DHHR's Customer Service Center at 1-877-716-1212. That is 877-716-1212. Thank you.
Thank you, Secretary. And finally, to Dr. Anam Chad, our State Health Officer.
Good afternoon. You will see one dashboard change that we're going to make. The California variant has moved from a variant of concern to a variant of interest. This one variant, the California variant, has been seeing a decrease in trends across the country. It has been responding to treatments, and it has not been that making people very sick, so to speak. So we are going to make that change on our dashboard in the next couple of days. So you might notice that the California variant will not be noted on there. We did speak with our epidemiology team earlier today about that, but just wanted to make note of that in case anyone has been watching that. But that's the California variant. And as Clay mentioned, we are watching the Delta variant. So if there's any questions about that, we can answer that later on. Thanks, Jordan.
Thank you, Doctor. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. Considering the success that the fiscal year had and the amount in the rainy day fund, which by my count looks like it definitely hit the $1 billion mark, with putting half of the remaining excess into the rainy day fund and the $50 million that was put in last Thursday's special session. Brian Abraham had mentioned something in one of the committees, the House Finance Committee, about the possibility of changing up the law that requires money at the end of the fiscal year to be put, half of it being put in the rainy day fund. I was wondering if that is something we're going to see anytime soon, or maybe in the next legislative session. And is there any concern that the bond rating agencies might have with possibly creating such a law to cap the rainy day fund where it's at? Thank you.
Well, Stephen, hello, and I hope you're doing great, and surely hope you have a great Fourth and everything. But the rainy day fund being topped at where it is right now is in phenomenal shape. It's something, I guess, the legislature, it's really for them to consider, and I think they should do so. And you know, from the standpoint of having to put half the money in there, from the standpoint of the rating agencies are tickled to death. You know, we're right where we need to be, and you know, in the 17 to 23% of the general revenue that's in rainy day funds. I mean, it's we're right in the sweet spot, and you know, for all I know, Stephen, the rating agencies are tickled to death, and the legislature, we need them to, you know, think about that and consider that, and you know, we're at the top end of that 17 to 23% level, and so, you know, we continue to consult with our financial people and our financial advisors, and we just, you know, that's part of running the store, just staying on top of everything, and I think right now we're in great shape on that.
All right, thank you, Stephen. Next to Jasmine Aduse with WDTV.
Hi everyone, Jasmine Aduse, WDTV. This question is really for more so for Dr. Clay Marsh. You know, with the Delta variant, as we were talking about earlier, just with regard to that, what should we consider as families are thinking about, you know, the upcoming school year with kids 5 to 11 years old who aren't vaccinated, especially as it relates to the COVID variant, the Delta variant? Kind of just if Dr. Clay Marsh could kind of expand a little bit on that. Thank you.
Hey, Doc, it's you.
Thank you, Governor, and thank you, Jasmine. You know, more and more there's guidance that's coming from experts, and we're waiting on guidance from the Centers for Disease Control. But I think that what we are finding and would recommend for parents with children less than 12 years old who are not currently eligible for vaccination is that if you're around a lot of other people, particularly people that are not vaccinated, or if you're in mixed groups where the Delta variant is more common, and again in West Virginia, right at the beginning of that, then these experts are recommending that children, if they can, should wear masks in those situations, and should take cautions, washing their hands, maybe staying physically distanced a bit, because we know that this Delta variant can infect anybody much more avidly than we have seen with the base virus that came from Wuhan, China, and even the UK variant that was more infectious than the base virus. So right now, the CDC, the Centers for Disease Control, and the Food and Drug Administration are in active discussions about how quickly we should consider lowering the age in which we can immunize children, particularly with the messenger RNA vaccines, the Pfizer and Moderna, which have been shown to be incredibly effective against the Delta variant when both doses are given and people are 2 weeks out. But in the meantime, particularly in areas where high amounts of the Delta virus are found, in the US, that's really most specifically right now in Missouri, which is having the biggest outbreak. About 46% of their cases are from the Delta variant. But as we watch West Virginia, all parents should be really cautious, and particularly cautious if their children have a pre-existing medical condition, because that seems to be the group of children that are the highest risk of getting really sick with this illness potentially. So during the upcoming school year, when people are inside and when you're taking your children inside with mixed groups, probably good to protect them. Outside, generally the viral spread is much lower. Hope that helped.
Thank you, Jasmine. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I was wondering if you could go a little bit more into your priorities for the state's share of funds for the American Rescue Plan. When I asked about it earlier in the week, you said that was going to be the next thing you were going to have the legislature focus on, and you mentioned funding for broadband. What else would you like to see done with that funding? Thank you, sir.
Well, Charles, I think it's premature and everything. We haven't really gotten through all that and everything. Broadband is really at the top of all the list, as far as I'm concerned. It's the newest highway that we can now tackle and everything. We've done an awful lot in regard to our roads. We want to stay on top of our, all of the different aspects of our road system in West Virginia, but broadband is really at the top of the list to me, and there's surely other things, but I don't want to tell you 3 or 4 and then leave off 3 or 4 right now, but we'll be getting in that real soon, and then going to the legislature and asking them to come back in and approve or bless what we've sent up to them, but we'll do that right away. I just don't have it right yet. And Charles, you know me, I'm not dancing through the raindrops, and I just don't have it put together yet.
All right, thank you, Charles. Governor, I'll come back to you for just a moment.
Okay, we've lost a gentleman, that was awfully a very integral part in West Virginia at WOWK in Charleston and everything. But Rod Jackson, we just lost him a couple of days ago. A father, a granddad, and just a really good man. And some way, somehow I got through this without mentioning him and everything. And we want to pass along all of our condolences and ask for all of our prayers and everything. I know Mark Curtis is on now, and maybe Mark could come on and ask a question if he chooses to do so. But a good man. We lost him and everything, and I surely wanted to recognize him and thank him for all that he brought to West Virginia and all the great work that he did, and just a kindness. I mean, a good man. But Mark?
Thank you, Governor.
Okay, Mark, okay. Go
I
ahead.
want to thank the governor for his kind words about Rod. As many of you may know, Rod was the news director here and really the brains behind the first 4 live town hall meetings we did on the whole our network in West Virginia when COVID-19 began. He was a visionary guy who really saw the importance to get good information out to the public about this pandemic from the very get-go, right out of the starting gate. I'll tell you a cute story, though, Governor. In the past year, you and your wife, Kathy, me and my wife, Kathy, and Rod Jackson all had the sad duty of burying a beloved family pet. And I say that because Rod was a huge pet lover, as we all are. And I just want to tell you, in his final weeks and days, as he courageously fought his cancer, he absolutely loved everything you were doing with Baby Dog, with the lottery and putting Baby Dog up on your table. And he loved that dog so much, and it brought him a lot of joy and happiness in his final days. So we thank you for that. God bless his soul. My question is this, and maybe the doctors can handle this. The other day we had 4 Delta variant cases. Then we had a dozen on Tuesday. Today, 2 days later, we're still at a dozen. What have you done to contact trace these 12 cases? Are these people quarantined? Are you confident we've got a lid on this, that we haven't had any more Delta variant cases in the last couple of days? Or is this still a very fluid and dangerous situation?
General, you and Dr. Amjad answer this, but I do believe that we just not had a real update, Mark, with our system and everything. But General, maybe you could answer this, please.
Governor, I think Dr. Amjad has the latest data on variants in West Virginia, so I'll pass to her.
Yes, Governor and Jim. Mark, to answer some of that, I think part of it is we are updating our system and getting information from our epidemiologists. So we are at 12 right now. And not to, put any alarm bells out there, but it is a very highly transmittable variant. So while we're at 12, most of those cases were already in family units. So they were with members in an immediate household or unit. So it was self-contained. So we were able to find out that some of those cases were self-contained or isolated in that family. So I think that's one reason we haven't seen a quick uptick in that number already. And so that's one thing to put out there. But, as we saw COVID, how it kind of spiraled quickly, and you saw the UK variant initially, we had a very small amount of numbers, and then we quickly picked up to 200, and then we're at 2,000 right now. We're not as high as, larger cities, but this number can also spike up rather quickly or exponentially. So that's also why we, continue to encourage people to get vaccinated in the state. So while the number is very small, we don't want people to take it for granted, especially as the summer rolls out and the holidays are coming in quickly for us. Thanks.
All right, thank you, Mark. Next to David Beard with the Dominion Post.
Hi, my question will be about the variants and masks. The mask mandate is lifted, and I think when I'm out at the stores, I see maybe 1% to 2% of people still wearing them. But with the variants kind of proliferating, I'm wondering if people who are unvaccinated or partially vaccinated should still be wearing them. And I guess editorially, I don't see that likely, but ideally, should they be? And following that, are there fears that we could see a new variant kind of inspired surge based on people being overconfident at this point with the mask mandate lifted? Thanks.
David, let me try to make a stab at this, and again, I don't blow smoke, and I'm pretty blunt, a lot of times. I want to be considerate, and I want to be respectful of people with their views and their rights and everything. But let's just think about it. If I hadn't been vaccinated, and for whatever reason, I just thought that I wasn't going to get vaccinated no matter what, you daggum right, I'd be wearing a mask. I'd be wearing a mask all the time. But the reality is just this. A lot of the people that ran through the streets saying, by God, I'm not wearing a mask. Well, a lot of them are in the 2,897 category right now. And, And you know, I would just say, just as point blank as I can say, you know, if you choose today to not wear a mask and you're not vaccinated, you're taking more and more and more risk. And you know, so it's just a matter of when your number's going to be drawn. That's just all there is to it.
All right, thank you, David. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Governor, more specifically, where does the money come from for the Do It for Baby Dog prizes? Is that CARES Act money from 2020 that had been in reserve for unemployment insurance? Thank you.
I think that's right, Brad. It's old CARES money from last year, you know, and you know, our people, that's where they found the money.
Thanks, Brad. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel and journalists, and to the family of Rod Jackson, condolences, and to our brothers over at WOWK. My thoughts are with you as well. I know that's a tough situation to go through. Governor, I wanted to ask you about, well, since we're in July and since Secretary Crouch brought up back to school a little bit in his comments, with schools reopening next month, will there be the opportunity for parents to opt out like they did last year and school from home? What are your thoughts? Where are you at on that? Will we have an update here before too long on what the policy is going to be? Thank you.
Paul, great question. And for what I know, the parents will be able to opt out. You know, and it will be a choice of the parents, you know, to be able to for the kids to go virtual, and you know, the bottom line on top of all of it, and Paul, we know this, but our kids need to be in school. I mean, really and truly, you know, they miss so much not being in school, and I think overwhelmingly, you know, we'll have kids back in school, but I do think parents will have the you know, the optionality, and I don't know exactly the details, and I hope I'm right in what I just told you, but I think that's the case.
All right, thanks, Paul. Governor, back to you.
Okay, I want to go back to Rod Jackson just one second, and I loved Mark Curtis's, you know, comments about him. You know, there's lots of us out there that derive so much goodness from a pet, you know, from a companion, and I'm really tickled to hear, you know, how excited and how much maybe joy that Rod got out of seeing Baby Dog, not from the standpoint of Baby Dog, but from the standpoint of just goodness about his heart. I mean, you know, I've said it over and over, but you know, when you come home, your companion never seems to have a bad day. They're always happy to see you, and they're always full of love. You know, they pass along a lot of great lessons to all of us, do they not? You know, I'd like to again just express, you know, just talk just one second about the goodness of this man's heart. It had to be unbelievable. The kindness of a dad and a granddad. So remembering. And the last thing I'd say is just this, you know, and the only reason I kind of got on this was with the ABC interview and everything, just to recap West Virginia. Recap what you've done. It's unbelievable. You know, it just to touch on just a few, but first in the nursing homes and vaccination, first in the vaccine rollout. 87% of those that are 65 and older today have been vaccinated. 77%, almost 78 of the 50 and older have been vaccinated in West Virginia. There's no outbreaks in our church community. It's amazing. There's one new outbreak in our long-term care facilities, and there's one inmate in all the prison system in West Virginia that have COVID. The economics of our state are off the chart good. You just continue to roll along West Virginia, and we've done that by one thing. We stayed together. We stayed together. We've all pulled a rope trying to help one another, Sure, we've lost 2,897 great West Virginians that I ask for your prayers, and especially ask for your prayers for all the military and all the great people over the 4th of July. It's a great time in West Virginia, and absolutely, as we go forward, we're going to keep going north, and we're going to go together. I'm really proud of you. God bless each and every one of you. Thank you so much.